Chief Medical Officer of Britain, Dame Sally Davies, has written an article, and the article is being picked up all over the place, and it talks about resistance to antibiotics. And she says resistance to antibiotics risks a health catastrophe that should be up there in concern with terrorism and climate change. Now, I've talked about this before on the program, Lewis, and we've talked about the fact that we have potentially 10, 20 years from now, a situation where we will have broad resistance to the existing types of antibiotics. And because of the amount of time and money required to develop a new type of antibiotics, not a new variant to the existing types, but a new type of antibiotic, that we may have a real problem where we regress to a period where simple infections can lead to death in many more people than they do currently because of this resistance that is being built. Okay, well, Britain's chief medical officer is now saying the exact same thing. She says the growing ineffectiveness of antibiotics against infection is being compounded by a discovery void, as few new compounds are being developed to take their place. In 20 years' time, even minor surgery may lead to death through untreatable infection, she warns. This is a growing problem, and if we don't get it right, we will find ourselves in a health system not dissimilar from the early 19th century. She says, of course, this would affect not only the UK, but the world more broadly speaking. Professor Christopher Thomas, professor of molecular genetics at the University of Birmingham, added, "We need new ways to kill resistant bacteria or reduce their carriage of resistant genes. Novel approaches that might have appeared unrealistic a few years ago need to be explored." So developing a new type of antibiotic, remember, not a new variant, but a new type of antibiotic, requires about 10 years and $300 million. Now, the $300 million really should not be a prohibitive factor because, Natan, think about the cost that we will incur from the negative repercussions of not having antibiotics that work on people. It will make the $300 million seem like nothing.
Right. I think that medical science is finding, in terms of basic research, different ways of attacking bacteria with, for example, viruses that are being developed and modified to be able to attack bacteria. And I think that what's going to happen is there's going to be a gap between the time that we have a serious resistance issue and the time that we can actually use those new developments.
Right. That's definitely something that hopefully will happen in time. The World Health Organization is saying industrialized countries need to focus on prevention measures such as frequent hand washing and limiting antibacterial use, developing vaccines that can protect certain vulnerable populations, and reducing antibiotic use in animal farming and agriculture. That is another piece that we should also address, which is the resistance that is being built in humans through the consumption of animal protein that has been treated with antibiotics already. How concerned about this are you?
I'm pretty concerned about it. I mean, traditionally, people have a very bad habit, and that is not doing anything until it's absolutely necessary. We usually don't do things until something has become a disaster or we have no alternative. And
Is that human nature, though? Do you think there's something about human nature? I mean, we see that with climate change. We see at least a lot of people trying to resist doing anything now with climate change until we're absolutely sure there's a problem, the antibiotic thing. Is there something about human nature that does not allow for group planning that far ahead?
Yeah, and I don't know what it is. I mean, you see it everywhere. Like you just said, with the weather, with the economic crisis we had in this country, with the banks. You name it, all over the place. And I hope this isn't one of those cases because this could be catastrophic like they're talking about.
I slightly disagree with the idea that it's a human nature issue. I think that we have a political system that doesn't reward long-term planning in terms of the policies that we create. So
why would any president who knows they're not going to be in more than the rest of this term or at the most another term do something for which the benefits won't be seen until 10 or 15 years out?
Actually, I think that the president is probably the only one who could actually think of something that might lead to long-term beneficial changes, which is his legacy, whereas representatives and senators have the next election to look forward to, and they only look that far.
No question.
Perhaps.